Hello, yoga teachers. It's Vix here. Today, we're going to have a chat about back pain. So instead of going into the real technical stuff about discs, ligaments, facet joints, I'm just going to zoom out and talk to you about general back pain. I'm going to talk to you a little bit about the latest research on back pain from the physiotherapy world, and also how we can approach back pain in our classes to really include everybody and give them tangible options for practice. So back pain affects every single adult at some point in their lives. So it's the leading cause of people taking days off worldwide. So I often see terrified patients coming into the clinic who simply leant over and took a fork out of the dishwasher and their back just went. And these spasmodic type episodes of back pain that are excruciating leave us all feeling really terrified to move. So that's where it's quite a relevant topic for yoga teachers, because obviously we're quite well known for movement and backs, and it helps people with stress and back pain, and we're quite famous for that. And quite a lot of doctors and physios and osteos will recommend yoga for back pain. So let's look at the latest research. The latest research shows that most episodes of back pain will resolve on their own with no intervention within 3 weeks. There is a term called non-specific back pain. I don't know if you've heard of that term before, but a lot of evidence-based physios and osteos are starting to use that term. So this is an alternative to disc prolapse, facet irritation, facet sprain, and other terms that we've used in the past. And now the reason that we now are moving towards a non-specific, meaning we don't really know what is causing the pain, so we call it non-specific, is simply because even under scan, under MRI, it's really, really difficult to actually pinpoint what tissue is causing the pain, if any tissue at all. So another great fact that is perhaps a little bit difficult to tell people or to communicate with people is there's no clear correlation between tissue damage and back pain or pain in general. And we know this because a recent study that I will try and link into this video showed that when they took an MRI of 1,000 healthy people from the street, you're 20, great, come in, you're 30, groups of the age group. So they had at least a certain amount of people in each age group, no pain. They MRI'd their backs, and the results were startling. In the 50-year-olds, I think somewhere as high as 40% of them had one or more disc prolapse, no pain. In the 40 to 60-year-olds, a large percent had degeneration at the facet joints, loss of disc height, even completely degenerated discs. They found everything. And they've done a similar study on shoulders as well, where they found very similar results. So what we know from that study is that when someone has pain, first of all, we can't really say that if the scan shows a disc prolapse, that's actually what caused the pain. We used to test people very specifically. So, we would have the facet load tests. That's where you would lean them back and to the side to see whether the facet joint, when it's compressed, whether it produces pain. We would do tests where they sit on the couch and they have to slump forwards, and that would highlight any pressure on the discs. But the latest research is showing that actually those tests can sometimes rule things out, but not rule them in every case. So let's move on and talk about what pain is. Pain is a sensation, it's a protection, and it usually is there to help you. It's there to tell you that there's something that needs your attention. And again, it doesn't always mean that there is there's damage. If you think about walking in the forest, I think this was another study that I read. Someone's walking in the forest and they got bitten by a snake. They didn't even notice the bite at first. They looked down, saw the snake walking away. snaking away, and then panicked, then felt excruciating pain in their leg. A couple of months later, all healed, no problem at all. Walking in the forest again, they walked past a twig, and the twig, for a split second, reminded their brain of the snake bite. What happened? Excruciating pain. You could even see that the skin went red. So if you can kind of figure that out, you've got danger, snake bite, versus perceived danger, twig. Now, a twig can't really hurt you. And what had happened there is the brain had decided that that might be a snake. So as a protectionary measure, sent out the pain to warn you, to get you away. So pain is actually not an input. You don't have pain receptors in the body. You do have damage receptors. So you have receptors in all of the tissues in the body that pick up damage, but you don't actually have pain receptors. Pain is a complex output from the brain. So let me paint this as a journey for you. You walk past the twig brushes the skin very, very quickly. You felt that the sensation landed on the skin. That sensation is sent up to the spinal cord, up to the brain, is filtered through all of these brain centers, including places where memories are kept, fears, perceived dangers. And then the brain decides in a split second, I reckon that's a snake biting us again. Do you remember how painful that was? Quick, sends out pain, sends out protection, sends out muscle contraction, sends blood supply. So this is not actually damage. This is almost like an opinion. You've made an opinion, an informed choice based on the perceived danger. So that is why in physical therapy, with the latest research in mind and anecdotally seeing patients in clinic, I would agree this is the case. We must get away a little bit and walk away from the biomechanical model of pain equals damage. Find it, fix it, leave it alone, a very common statement in osteopathy. And we should move more towards thinking about the whole picture. What was the perceived danger? Perhaps the back always hurts when you drive past the rugby field because you once fell over during a rugby tackle and had a very bad few months. That stuff plays a role. Now, of course, disc prolapses can hurt. Straining the muscles can hurt. But considering the whole picture, we need to move on and talk about fear avoidance. So as yoga teachers, yoga therapists, osteos, physios, whatever, we need to be very mindful about our communication with our clients, because it's very common that telling someone that there's a danger will create an even bigger file in the head, perceived danger file, and that can lead to a longer lasting pain. So if you came into yoga class or to the clinic and you said, oh, I've got this pain in my back, and you said, oh, I had one of those once, or every time I bent forwards, it was excruciating, and I was off work for 3 months. Already, as you're speaking, their backs are tensing, the perceived danger is growing in the head. And this, according not only to my opinion, but according to the really great research on pain science, this is actually quite dangerous for that person, because if they perceive it to be very dangerous, it can lead to chronic pain, so pain lasting much longer than 3 months, even when there's no damage. So you don't have to have damage to have pain. So the concept of fear avoidance is when somebody is avoiding a movement because they think it's going to cause them pain. And that leads to longer term problems. So if we look at the case of back pain again in the yoga class, someone comes in and they say, my back's sore, and you say, really be careful, don't bend forwards, don't go to the side. They're going to create that tension in the back, and the fear is going to be there, and they may then struggle. And I'm telling you, if you tell someone it's probably going to hurt and they're convinced by you, it probably will. So park that for a second. Let's talk about yoga classes and how to handle this in that case. Now, I would say as yoga teachers that are not physio, osteos, chiros, sports therapists, it's probably quite important to always take a step back and really do your studying and really know that if you're going to give advice or any kind of comment, that you know kind of what you're talking about. So with back pain, most people should continue to move unless they have some sort of fracture, compression fracture, or some kind of slippage of the vertebra. So if they've got disc issues, strained back muscles, or just general pain in the area, and they have been to see someone and they've said it might be a disc, it might be this, it might be that, but it's not broken, and you don't have osteoporosis, for example, where you've got a density issue in the bones, brittle bones, then these people should keep moving. And yoga is like the best place to get people moving properly, because we stand, we breathe, we do things really mindfully. And so it's a good idea to have a chat with that person. And of course, you can always contact me or anyone else that you know who's a physical therapist, and you can always double check, is it okay for me to still teach this person? But I will just reiterate, as long as that person's not suffering from brittle bones or fractures or loss of power to the leg. So in some cases there can be a compression on the nerves, and that can cause quite serious kind of loss of power in the legs. They definitely need to seek help before they start just self-prescribing yoga classes or whatever. So if your student comes in and they've got back pain and they have full feeling of the legs, no problem. They can move the legs. They've just got back pain. They don't really have pins and needles, but even if they do have a little bit of pins and needles, that's okay. Then in my honest opinion, it's a good idea for them to do a slow, gentle flow. Of course, handstands, back bends, not that back bends are bad, but I'm talking more dynamic practices may be a little bit too much. I'm thinking more those nice hatha classes, hatha flow. So if you do teach something like that, then you should invite people in that suffer a little bit with general back pain, because getting them moving is so valuable. And mindfully getting them moving with diaphragm, pelvic floor, and core, and good hip mobility, and all the things we do in yoga are so good as part of that healing journey. And often the rehab exercises that we prescribe look a tiny bit like yoga. I often give the bird dog, hands and knees, arms, leg back, and that gets the muscles across the back of the body, the cross chains working. And actually, I follow a really amazing spine physio. I think he's in Belgium. And when people come in and they're really coming in pain, he will get them flexing forward with a weight in their hand on that very same appointment. So I hope that's been really helpful, and please get in touch with any questions. Sometimes I miss a few things. So I want to make it really clear that you should always respect injury, and always make sure that a person has either has had some help or some at least spoken to either a physical therapist or a doctor if they're experiencing extremely bad symptoms, any loss of power in the legs, extreme pins and needles, or they're of an older generation and you think, I want to make sure that their bones and joints are okay. So other than that, we want to keep people moving, and yoga teachers can really help with that, because it gets people confidently moving even when they've got pain. And we shouldn't be too afraid of pain, remembering that pain sometimes is a perceived danger or a protection. So we need to sometimes re-educate the brain and keep moving. Moving is key, and movement is life. Thank you.